Long COVID, the affliction suffered by those who pulled through the initial infection, estimated to be one of every 3 or 4 sickened by the virus.
We've had multi-millions of cases of COVID in this country. I mean, let's do the math. And 20% of those individuals, we're talking about millions of individuals who have long COVID. And those individuals are really impaired.
I was a healthy young woman, had no troubles whatsoever, and then this happened all of a sudden.
You've got people with anxiety and depression and different mood disorders because of what has just happened in their life.
We don't have two people that have the same exact symptoms, and everyone's recovering at a much different recovery rate as well.
The minute I see someone and I don't immediately know what they have, it's a strange symptom, I'll think, this is probably another case of COVID, and it almost always is.
Last month, the National Institutes of Health announced it would do a population study of long COVID cases nationwide. The website says progress takes people like you. Learning comes from listening.
The most common things we see are generalized fatigue, brain fog, not being able to return to work, not being able to complete their activities of daily living. What we find is they can have fluctuations or changes in their blood pressure.
Dr. Eva Feldman, a neurology professor at University of Michigan Medicine, she's found much of the body's nervous system can be affected by the virus.
It's such an interesting virus. It's like a chameleon. It can do almost anything.
In Ann Arbor, they're checking long COVID blood samples for markers indicating inflammation, along with the examination of vital organs.
Talk to me about how things are going in general.
Henry Ford Health System speech-language pathologist Angeli Lodhavia is working with long COVID patient Jackie O'Connell, who's struggling with memory issues.
When I have everything set out, it's there and I do it. But when it's something I have to actually think about, that's when
It's almost like your brain shuts down.
yeah.
O'Connell got COVID this January. She lost her taste and smell, but no congestion. She'd been a case manager for a healthcare provider, but she's not working now.
Today I'm going to introduce you to some acronyms and walk you through different memory strategies that you can use.
With Jackie, she stayed at home for 2 weeks, returned to her job, and realized, whoa, like I can't do this. Like I can't even look at the computer screen without freaking out.
What did that stand for?
I don't remember.
Take a second.
Okay.
Even if you're like, I have no idea, I'm drawing a blank. Take a second. What things are you going to do to help yourself remember?
I think the surprising thing for me is that all of the patients I'm seeing with brain fog were not hospitalized and they had mild cases.
Lodhavia sees people with strokes, brain injuries, Alzheimer's, that sort of thing. Add long COVID to the list.
It just makes sense to have them go through this cognitive rehab program that we've been doing for other patients before COVID to help treat some of these long haul patients.
Like I even have to do a resume for the disability. I'm like, it didn't make sense. It all threw me.
Was it more helpful after you went through it with your sister?
Yeah, I'm going back over there this evening and she's filling out all the papers with me.
They're not able to remember some of the conversations that they're having. You know, if you look at these people and you run into them on the street, you don't see any physical impairment from COVID.
And we as physicians can help them symptomatically. We're doing like diet, exercise, occupational physical therapy. But we don't have any magic pill or cure for this, so it's affecting a lot of people.
Physical therapist Carolyn Brierly with the Detroit Medical Center's Rehabilitation Institute of Michigan. She too has been seeing a lot of long haulers.
We knew nothing about how to treat this prior to it hitting, and now it's going to be a constant learning, on what we can and cannot do, what is best practice for our patients.
So I got COVID in the beginning of May. I luckily enough had a mild case of it, so it was kind of like a bad cold essentially.
Detroiter Kennedy Robinson, age 23, getting ready to graduate from college and getting physical therapy 3 times a week at the Rehabilitation Institute of Michigan.
I have never felt so tired in my arms ever. So you don't really realize how much of your muscles you use until they're taken away from you.
For some of our long haulers, we're seeing them in physical therapy for sometimes 4 to 6 months because they're so deconditioned when they come to us that we now have to build that back up. We have to build muscle strength, we have to build coordination, we have to teach them how to breathe properly again.
So in Kennedy's case, what's occurred is affected what are known as her peripheral nerves, as well as likely, possibly her muscles.
I couldn't do like basic things such as dressing myself, feeding myself.
Robinson had no cognitive issues to report. It was nerves to her legs and more so her arms.
As you can clearly see, I struggle with getting my hands up. They did lots of blood tests, did MRI scans, CT scans, and everything came up negative. Everything came up clear, like nothing was wrong with me. Every time I would do things for them, they would look at me like I was faking it.
Not an uncommon experience for some long haulers. Robinson found another opinion from Dr. Feldman at Michigan Medicine. A diagnosis just part of the challenge. Paying for it can be a problem too.
I have patients who filed for disability and they're not getting approved for it because, they're able to wake up in the morning and make their cup of coffee and, drive to the doctor, and those things are fine. But when it comes to doing their cognitively taxing job, they are not able to do that.
Are you making lists?
No. I honestly haven't been.
Okay.
We just don't know what's happening, whether this is partly psychosomatic, this is actually something going on in the brain, whether it's a component of both, which is probably the likely case. I think we all just want to know more about it and look at the patterns across patients to try and figure out the best way to treat them.
Now I've progressed a lot comparing from how I was back in June, where I could only lift about maybe up to here with my arms in June. Now I can go all the way up to here. My boyfriend has asked me multiple times about how long this would last, and I always tell him, I honestly don't know. It just really depends. Honestly, recovery time could be from either 6 months to almost 3 years.
So as we began to better understand that this was a real syndrome and really happening after COVID, that's happening in parallel with the patients, really forming support groups and beginning to collect their own data so we can understand the symptoms that are occurring.
Patients conferring with each other online. Detroit area physical therapist Ted DeShane got COVID early on, March last year. His initial sickness passed. Then came a persistent fatigue.
It wasn't until I connected with a few other therapists on Twitter who were experiencing the same thing that we kind of realized that this, was more than just, our acute COVID infection. We were having something that was continuing beyond those 2 weeks that we thought we were better in.
DeShane's online connections led to a support group, Long COVID Physio. 200 members now, all physical therapists with long COVID from around the world, talking about things that turn up in the media months later. What have you learned from some of these online conversations that maybe is a little even ahead of the curve of some of the medical establishment?
Yeah, we were really fortunate to kind of connect with some people who had suffered from post-viral illnesses prior to COVID-19. We've seen these kind of similar things happen after Epstein-Barr infections, after the first SARS virus in Toronto, after Ebola. So we connected with a lot of people early on who were already experiencing those kind of post-viral illnesses and used what they knew worked to kind of help our treatment. So
DeShane's group finds a physical rehab regimen not so useful in many cases like his, finding it's a matter of resting a lot more. A year and a half later, he's at about 85% strength of where he was before he got the bug.
But I just don't know if the government is really monitoring the amount of burden this is placing on our society as a whole. And if the U.S. knew the burden that this could cause, then they might be doing a little better job about trying to get a handle on it.
The economic damage from long COVID so far, hard to say. The NIH has about $500 million to do their population study. Add that to more than $1 billion for other studies over the next 4 years.
It's clear that not everyone gets over post-COVID syndrome, at least not that we're seeing yet. But again, the disease is new, right? This is all very new and young.
There are going to be other people that are coming in with the exact same problem that I'm having. And again, they're probably thinking like, oh, well, this is new. We don't know what's going on. And actually, yes, you do, because I am that person that was dealing with the exact same thing. Like, essentially, like, learn from me.